Today we are talking about all acne related problems, and I'll specifically be talking about the queries that I've received about acne from all of you. The first one that I want to talk about is that someone asked me that when a patient walks in with acne and we use a magnifying lens and try examining what are we looking for on the face and what are the kinds of things that we can find. So as a dermatologist, the first thing that we are looking for is whether a patient who says that he has acne actually has acne, or is it something else. Because things like folliculitis, which is just the infection of face hair, like some men can have that in the beard area or even females have it, is actually folliculitis, and it looks like acne but it's actually not acne. Also, sometimes people come with acne, but they are not exactly acne from their endogenous causes, but is because of a cream that they have applied, which could be a steroid based cream, and they are steroid induced acne. So the treatment line completely changes if that is the picture. Also, when we examine, depending upon what is the kind of acne or how is the number of acne and size, our treatment also changes. Sometimes we have very small growths or very small acne under the skin. These are actually called comedons or microcomedons. They could either be closed comedons or open comedons, depending upon whether their head is black or white. Also, sometimes there are pus-filled acne which actually require a different treatment, especially in terms of antibiotic. And sometimes the acne is very big in size, and that could be an acne cyst. Now that will obviously require an intralesional injection for it to subside properly. Now that is mostly about the examination and what we see when we are examining acne. So I spoke about steroid induced acne. So my next question was that when we say it's steroid induced, or is it because of a cream that we have applied, what is it? So in India it's very common when a person has acne, तो वो nearby pharmacy पे जाते हैं कि मुझे दाने हो गए हैं और आप ट्यूब दे दो. So the commonest medicine that is oversold on the counter is a steroid, and a steroid does give you good effects when it is applied initially, but over long period of time it does a lot of damage to the skin. So it is absolutely contraindicated from a dermatologist point of view. It should not be done, because if you apply steroid for a really long time, you will not only get acne, your skin will become more photosensitive, your skin will have pigmentation issues, it may turn red also, and the skin veins are also visible, like especially on the face the skin becomes very thin and the underlying veins are visible. So steroid is something that should completely be avoided. But what to do if someone has actually done it, how to treat that? So first and foremost is avoiding any further exposure. We do not want steroid application. Secondly, those acne actually require a lot of repairing of skin. Skin has to heal first before your acne subside. Regular sunscreen becomes very important, and judicious use of the products that can be given, like a repair gel or a healing gel. A lot of ceramides and peptides are required for those patients for the skin barrier to heal completely. These patients actually sometimes come with a lot of acne on the body as well. Like you might have heard of people who went to the gym, took a supplement and then started developing acne, either on the body like front or back or on the face. Those are also steroid induced acne, and yes, they will require a different kind of attention. Next obviously is a question about cystic acne, which were thick or big sized acne. So what do you do about those? So when we have an acne which is slightly big in size or is hard to touch or has formed a scar, then we require an intralesional injection in that so that it kind of subsides. But again, a lot of care has to be given as to the plane in which that injection is given, because if it is given very superficially or if it is given very deep, it may actually produce a scar which was not there initially. So please go to a dermatologist and only then get an injection in that acne. I also have a query which says what is benzoyl peroxide. So yes, benzoyl peroxide is a very good molecule for acne. It clears out acne, it actually reduces inflammation also, but for some people it is actually slightly irritant. So maybe start slowly, like titrate the dose, maybe apply it for a short period of time and then gradually increase it. Also, benzoyl peroxide works really well in the wash form. Like you use benzoyl peroxide to wash the face, and it could be for a very short period that your skin comes in contact with the drug. Sometimes some people feel that there is pigmentation post benzoyl peroxide, so that is also a concern that one has to tell their doctor that if they are facing this, benzoyl peroxide has to be stopped. But it's a great drug to actually control acne. So, talking about oral medications for acne. So yes, there are antibiotics which can be given in acne. They rather have to be given, but now the trend is changing. That period has gone where we used to give antibiotics for a long period if their acne are not getting controlled. We don't do that anymore. We give them for short periods. We also add medication which have isotretinoin in it. That controls acne really well, but it should obviously be done along with some tests which require lipid profile checking or your liver function before and after starting isotretinoin. So be careful, but for acne which are not getting controlled by any other medication, that works really well. Coming to the last part of this session is the treatments you can do in the clinic. Those are chemical peels, especially which are salicylic acid based, or black peels which work really well on resistant acne. So all in all, acne is something that can be treated provided you go to the right doctor and take right treatment for your acne. Comment for any other query that you have acne related, and also share this video with anyone who you know has acne and is struggling with it. You can subscribe to our YouTube channel and press the bell icon for future notifications.